Day in the life of a student.
Touring around the different medical departments of Southwestern University, Sinma.
Yeah.
First stop is RADTech. Here we learn about the history of X-rays, the role of a RADTech, and how they work with radiologists. We got to see also how the machines work and how to operate them.
This is what we call chest peaking. It's because asthenic, stenic, or hyperstenic na patient. So we are the one manipulating this. So that's your line. So kita position sa kurba kay para makitaan or mabasa o grado sa inyong radiologist. So technically, third year, once you become third year, positioning will be more important.
At our second stop, we explored the physical therapy department and learned about its role in rehabilitation and patient care. We were invited to different stations, each showcasing a key aspect of PT. The first station focused on posture and imbalance assessment, where we saw how therapists identify abnormalities in a patient's body alignment.
In the knees, mag-check ka if level na sila bones, their bone as ma-check and enlarge the shoulder. If ang right side, dili ba
Next, we moved to recovery exercises, learning about proper positioning and techniques that help injured patients regain mobility.
bodybuilders, that's how they go to muscle, but specific to exercise, dili lang muscle building. It's also for endurance, it's also for okay, dili ka pwede mo rule is to prevent injury, further injury. What if
Lastly, we explored hand therapy and pulse contraction, which are used to improve grip strength and assess muscle responsiveness.
Our third stop was occupational therapy, or OT, where we explored its roles in helping patients regain independence.
For OT nga, after sa walking nila, ma-achieve ng walking, then ang OT na sa so for combination ng mag-transition sa CR to Quandera para maligo. So nga na siya ang sense. Okay? Sige.
Para magbuwa sila cards, dili ganyan sila pinaka-adapt at holding all of the cards. So, ako maka-afford para magawa ng nilubaraha, balik itong card holder. As OTs, you can manufacture your own card holder using mga materials that you have at home.
The first station introduced apps for speech-impaired patients to customize their voices.
How are you? Okay. What's your name? Princess. Wow, princess. So, that's how you use the communication board. So,
The second showcased DIY tools that assist with daily tasks like buttoning a shirt. The third station demonstrated proper techniques for safely transferring patients using a wheelchair.
Next, we explore pharmacy.
It is illegal or against the law na mag-operate ang isang pharmacy store or yung mga Watsons or whatsoever nang walang pharmacist inside. Because ang FDA po natin, they are visiting pharmacy store randomly, no? Hindi na unannounced, okay? And ganahan sila mag-disguise as customer. Okay? Maraming job ang isang pharmacist, okay? So we can say that pharmacists, they ensure that the patients receive the right.
Where we learn about the field and its work environment. We observe how pharmacists ensure the safe and effective use of medications, including reading and processing prescriptions.
101 means it can be taken morning and night. Pag 100, morning only. Pag 001, night only. We can decode that.
Checking for drug interactions and advising patients on proper medication use. Additionally, we gain insight into how medicines are categorized and dispensed.
So what we do here is 5, 10, 15, and then 20. So kanila ang paliton sa patient. container, that means ang kaning nabili mo ni ang paliton. And don't say, always na siya close diri. Open is kaning diri. So, siya i-pour. Okay. Once na-pour na siya diri, that's why sometimes you buy medicine na kay ani, if you observe. That's your prescription is 20 and then you dispense 20. Kasi mo bata sa prescription. Minus 20 and then FS and then date. Very good. And then kasi bata sa prescription. Very good. Carefully serve siya. Okay. Let's
After lunch, we took a short break before heading to the dentistry department.
No.
Nami sa dentistry ron, nag-tour mi sa mga rooms na naay mga dentist chairs and very nice, very cold actually.
Narami sa second floor and next ito mi fourth.
Fourth and then after ana kay 7th floor.
So padaw na mayroon ng fourth.
We explored different rooms for various dental procedures and learned about dental care. Dentistry had a very well-designed building and their top floor had a great view.
We're done sa dentistry, guys. Now we're on our way sa vetmed.
Our next stop is the veterinary medicine department where we explored key aspects of veterinary practice and education. We began our tour in a designated room where we were introduced to Southpaws, the veterinary clinic within Southwestern University, FINMA. Here, we learned about the clinic's role in providing medical care for animals and how veterinary students gain hands-on experience in diagnosing and treating patients. Next, we moved into another room where veterinary students demonstrated proper dog handling techniques during vaccination. Using a stuffed toy dog, they showed us how to properly restrain and comfort an animal to ensure a smooth and safe vaccination process. This was an important lesson in handling animals with care and precision.
Blood collection. So mag-demo mi karon sa blood collection and vaccination to give you an idea. Imong arm around sa iyang neck. So if kani ang imong kuan mo blood, so dili na kita ana. But if kani siya, dili ka dili balisan siya. Next level.
So once na-set na yung restraint, response is palitan ninyo ang process.
After that, we entered a laboratory room where we were introduced to essential lab tools used in veterinary diagnostics. One of the highlights was the autoclave, a crucial device for sterilizing surgical instruments and laboratory equipment. The vet student explained how the different lab tools were essential in their profession. For the final stop in the veterinary clinic, it was the operating room where we were given a basic lesson on suturing. We learned fundamental stitching techniques used to close wounds after surgeries or injuries. This hands-on experience gave us a glimpse into the surgical side of veterinary medicine and the precision required in the field.
So we have here mga tawag cams, scissors, and we also have forceps. Then we have here, for example, here man na inyong patient, you will cover your patient with drapes. So forceps. So for example, na-open na niya ang skin, you have to bite sa opposite side and then the other side. pharmacy, you have surgeon's knot. This is one of the most common knots sa surgery. So, if you do proceed, so this is called surgeon's knot, double loop, and then single loop.
During our opto, we explored the process of making eyeglasses and learned about different types of lenses. In the glasses making room, we saw how frames are shaped and lenses are fitted. We also discovered various lens types, and the tour gave us a deeper appreciation for the role of optics in vision and technology.
Externs. Interns. Exit these are the batch who will take the board exam. Chart. Pictures.
In the nursing department, we entered a mock hospital room. We were shown the different kinds of situations a nurse would experience. There was a mock patient who was a doll that had a heartbeat, that blinked, and much more. There was also multiple pretend genitals, a full-body human with organs being showcased, different kinds of hospital rooms, and equipment a nurse would use.
So kaning tanan doctor mo tingog to siya depende sa unsay imuhang gibati. So everything we na adri sa school is for mga advanced of high-tech and technology in nursing. So
in the medtech department, we were taught the different kind of color coding when it comes to test tubes, how to locate veins for an injection, and the different kinds of syringe needles. During our batch, one of the medtech students did a blood test on Noel, indicating his blood type and discussing how we inherit blood types, traits, or genetics from our parents.
Relax lang ha, tos po gamay dear.
Blow na na, miss.
Nahon mo ang tourniquet sa needle, kaya nga naman. Okay. And then you cover, but do not push the gauze or the cotton yet. Extract first the syringe and then put pressure. Kaya, di ba? Okay, put pressure. Okay, so for your EDTA, either na siya OML, naman na siya yung marker here. Transfer it. Ipa-slide ra ang blood sa tube.
Thank you so much for watching our vlog. We hope you enjoyed exploring the campus and learning with us. Who knows, Southwestern might just be your med school destiny, because here we stop at nothing to become the best version of ourselves.